Hi, I'm Carol McCorster. I'm the Mental Wellness Program Manager with Southeast Tribal Council. I have a team of 7. I have 2 outreach workers, a case manager. I have a addictions coordinator, as well as 3 therapists. So our team was deployed in the last year and a half to help in the pandemic of our 7 communities that we work with. The first part of the pandemic, our teams were deployed into our communities to provide wellness support to frontline staff, which were nurses and administrative clerk, to do some of the pandemic testing and contact tracing.
While we were in the community, and especially when people were being vaccinated or now learning about the vaccine process, there was a lot of concern regarding vaccine hesitancy and the risks associated with the vaccine. The mental wellness team provided a lot of information to calm and control some of the fears that our client population had.
When we go in, they're more relaxed with us because we're traditional people ourselves, and they know that we understand what's going on in their communities. So those things we were able to do, even with COVID. In some of the communities that we went to where they were vaccinating or testing, we would have a sacred fire burning, and we would have tobacco in there where people could go and offer prayers and to ask for help with what they were going through. And so they really enjoyed that. And the fire is something that is really important, really central to a lot of traditional peoples and their way of life.
During this pandemic, I have been dealing with a lot of issues that have come up because of the pandemic itself. Some of those things being people being removed from their communities that have had COVID, and they've been relocated to a alternative accommodation site. And here at Southeast, we do have a site that is working at former St. Benedict's residence on Masters Avenue in West St. Paul. But so the families have been coming in with children, a lot of them, people coming in who have not been away from their community for a long time, and they're expected to recover here for long periods of time.
We also did mental wellness checks with the people that were in hotels. I would come to the site at times when I was invited in to come and meet one-on-one with clients, but I would have to wear the PPE. And I would do virtual training during the time of COVID. So we had, and we've extended it to not just NADAP workers, but the BFI, BHC. And so we've extended that program also to all frontline workers, STAR. And the reason we extended it is because sometimes when a client comes, they want to work specifically with that worker.
And I started working here earlier in this year. And one of my roles is to work on the AIA side. So I see clients that comes from the different communities. So what we do here really is to give a wraparound service. So we have nurses, we have healthcare aid, we have all those services. So we thought that having a psychotherapist on site would be helpful as well.
So in closing, I think that our team did phenomenal. I am so proud of them. They've all chipped in and became a team player. I always make sure that my team is taken care of. So when they're deployed out into the communities, when they come back, we make sure that we have debriefing circles. We do our one-on-ones as well. I check in with my staff to ensure they're okay. We provide the ceremonial piece as well. We do the smudging, we do the cedar baths. We also have an elder from one of our communities, Black River, who does the Reiki and the traditional energy healing. So we always make sure that we implement that in our self-care and our team building days, which we like to have at least once a month. And that's what we did. I think we did a great great job. Thank you.